Hi, I'm Anna, and I'm going to be doing a little review of Emgality, the new migraine injection medicine from Eli Lilly. So my backstory, I guess, is that I've been having chronic headaches, chronic daily headaches, and classic migraines for about a little over 5 years now. They started in the summer of 2013. And I've been on a lot of medications, I think, as most migraine sufferers have, to help treat these, and none of them have been super successful. I've been on nortriptyline, nadolol, propranolol, Topamax, indomethacin, and nothing really helps. For the classic migraines, I can take a triptan and that will relieve them, but for the daily headaches, there's not really anything I can do. They just are there. So 2 years ago, I found a clinical trial for Eli Lilly that was supposed to help migraine sufferers. It was a double-blind trial, so at the time, you didn't know if you were getting the medication, but I was pretty sure I was because I stopped having the chronic daily headaches. They pretty much went away, and my classic migraines reduced as well. I went from having a headache 3 to 5 days a week and a classic migraine at least twice a month to not really having any daily headaches and having the classic migraines maybe once every 3 months. So it made a huge difference for me. And I went to the neurologist this week, and we just found out that the drug that I was on trial for is out now. So it's called Emgality. There are 3 drugs in this class that are available now. Emgality, Aimovig, which I think is the one most people will have heard of. It came out first, and then there's another one called Ajovy. We decided to just put me back on Emgality because I already know it works for me. So I just picked it up today. A little, I guess, word of warning. Insurance is not covering these medications yet, and without insurance they cost about $650 a month, and it's a lot of money. But because these pharmaceutical companies know that, I think all 3 of them have some kind of incentive to get people to start taking the drugs so that eventually insurance companies will start taking it, or start covering it. So I know Aimovig has like a 2 or 3 months free. Emgality actually has 12 months free. You just have to have a prescription, which I have. You'll get a little booklet like this that has, if you haven't already removed the card, it has a card. It just looks like a credit card, and you take that to the pharmacy when you go to pick it up, and you get your drug for free. It has a whole instruction booklet, but this is what it looks like. So it's a self-injecting injection. So you push the button and it pushes the plunger for you automatically. It can go in your thigh, your abdomen, the back of your arm, or your butt. I'm going to do mine in my thigh because it seems like that's going to be the easiest to do. When I was in the clinical trial, they did the injections for you and they did them in my abdomen. I would usually get, after the first couple, I would start getting a reaction to the medication, just like a little rash that would last for maybe 5 days, and it was super itchy, and it was right where my pants would hit, and so I don't really want to have that rash in that position again. So I figure if it's on my leg, I can cover it with some gauze or something, and then my pants won't bother it. So here we go. I'm gonna inject myself with some medication. After you inject yourself, it should go into a sharps container for disposal. I don't have a sharps container yet because I didn't really plan ahead on that. So I'm just gonna put it back in the box it came in until I get one. So you start out by, it has a little lock or unlock button, and you have to unlock it. Actually, just double check the instructions here. Also, it has to stay refrigerated, so you can keep it in the refrigerator until, if you pick it up before you're due for your injection, keep it in the refrigerator, and then you take it out half an hour before you're going to do the injection. It can sit out for up to 7 days, but if you leave it out for more than 7 days, you have to throw it away. And that is an expensive mistake. So I will probably just take it out half an hour before I go to do my injection and do it before the end of the day, and it'll be done. Okay. So make sure that the pen is locked, and then you twist off the base. So it has this base here. You twist it off. It comes out like this. Then twist the top to unlock. Now, for the moment of truth, I'm gonna flip my camera around so you guys can see the whole process. You just place it on your leg. I'm so nervous about this. Once you push the button, you have to hold it there for 10 seconds until you hear it click again. So here we go. Ah. 1, 2, 3, 4, 5. Oh, that wasn't 10 seconds, but it clicked. Okay. You can see, well, maybe you can see where the injection was. There's a little bit of medication that didn't go in. From what I remember from the clinical trial, that is normal. Also, you should clean the injection site with an alcohol swab before you put the injection in. I did that before I started the video. And then let me just grab a tissue. Sorry guys. To wipe up that little bit of blood. Ooh. And it's pretty much already stopped bleeding. You do not rub the injection site like you would for an EpiPen. It's like in bold letters, do not rub the injection site. But if you're bleeding, you just press a cotton ball or piece of gauze or a tissue or whatever to the site. It stings a little, but it's really not that bad. After you're done, put the cap back on and then dispose of it in a sharps container. If you don't have a sharps container, most doctor's offices will take them for you. At least mine said that they would. So that's the whole process. Obviously I'm not a doctor, but if you have any questions, I'm happy to answer them as best I can. So there you go, guys. There's my review of Emgality and how to use the self-propelled needle injection.